这个新冠感染之后，它就是有肌肉酸痛，慢慢就好了。如果疼得厉害，影响睡眠，你就吃一个布洛芬缓释片。
Dr. Wu Jizhen is busy replying to patients who consulted her on the internet hospital. When she's not in a face-to-face consultation, she takes her spare time to answer questions online. She has to squeeze her time from ward check and in-hospital consultation to do the online consultation work. One afternoon, she replied to over 100 patients and resolved their concerns.
我们指导他合理的用药。
We guide patients to use medicines correctly. For the elderly, we need to monitor his comorbidities, monitor whether his condition is getting worse, and help him evaluate whether he should seek a doctor or not. We can avoid some unnecessary doctor visits and delays in treatment.
Pregnant women are one of the most vulnerable groups who feel especially anxious at this time. The Henan Provincial People's Hospital also opened up online consultations specifically for them. Dr. Wu Haiying is one of the doctors providing online consultation. She said about 2 weeks ago, she received hundreds of consultation requests a day, but now the amount has dropped to around 10 patients per day. She would explain to patients that when pregnant women are infected with COVID-19, the possibility of infecting the fetus while it is in the womb is very low. Regarding medication for pregnant women, she suggests, unless absolutely necessary, try not to use any medications.
High fever may cause an abnormal fetal heart rate. In this case, if the fetal movement is normal, there is generally no problem. We will tell patients that the way of delivery will not change because of the infection, and we remind them what medications should or should not be used. After knowing all this information, patients' anxiety would ease.
During the pandemic, some people face psychological issues such as anxiety and fear. The Henan Provincial People's Hospital offers online psychological consultation. The consulting team consists mainly of psychiatrists, psychotherapists, and psychological counselors. They have recently encountered a peak as the number of COVID infections are rising.
会担心是自己会不会阳啊。
Many people fear that they would be infected and would infect vulnerable family members. Some patients have existing mental illness, and the pandemic situation would aggravate their condition. Our job is mainly to emphasize with them and ease their negative emotions. At the same time, there will be risk assessment, such as whether there is a risk of suicide. If there is, we will immediately activate the emergency state of suicide prevention.
Doctors told me that online services can alleviate patients' panic and prevent many mild patients from going to the hospital, thus reducing the pressure on medical resources. 周一新 CGTN 郑州河南 Province。